So the wonderful thing is that you're driving to the same place, you're parking in the same parking lot, you're coming into the same office and greeted by the same staff. So is reduces so much of the stress and anxiety patients will feel. You will go to a different section of our clinic, and we like to call it our spa because it is. We have dim, basically like candlelight, soft music playing, comfy recliners, and that's where your preoperative preparation begins. You go straight into one of our recliners. We'll give you some dilation drops to make your pupil big so we can remove your cataract. We also give medicine to relax you in the form of Valium and sometimes some other medications. No IV is required. And because we're not putting in an IV, you can eat before surgery up to 2 hours before surgery, which is great because you don't have to do the nothing to eat after midnight. You can take your medications like you normally do. So it feels like a more normal experience. And you can see, for those of you who have been to our clinic, this is kind of what our clinic looks like. And we have snacks for your driver because you will need a driver on the day of the surgery. Once you're done with the surgery, these are our recliners. You'll just be able to walk right into the operating room where we perform your surgery. Again, the same staff that you've already come to know when you came in for your evaluations. And then you'll go straight back into the recliner and your comfy blanket. We'll make sure you're good on all your instructions. We give you your first set of drops, and then you walk out of clinic. Most of our patients will grab something to eat in our complex. We're lucky to be above a Trader Joe's in an area with a bunch of nice restaurants. So after they're done with that, they come right back and we'll do their post-operative check that same day. So they don't have to come back the next day, and their driver does not have to take another day off of work to drive them. We already kind of went over what it feels like on the day of surgery, just a little bit of itchy, scratchy. Your homework is to use your drops that we have you get. That's an antibiotic and a steroid. You will use them 4 times a day for a week, and then we gradually kind of taper them off. Our patients are going to notice an improvement in their vision within the first couple of days after surgery. Most of our patients, we do surgery on Wednesdays. We tell them to kind of treat themselves and not do work until the following Monday. But depending on what patients' jobs are and whether, how clean and things they are, they can go back to work in a few days if they feel comfortable. So we have that discussion with everybody, but I would say 98% of our patients are back to work on that following Monday. We just want them to kind of rest their eyes so that they can heal better and can focus on putting their drops in. As far as activity restrictions, we really don't restrict too many of the things you need to do. But we don't want any dirty things getting in the eye. So I always tell patients, this is not the time to do your yard work or clean out your garage or help a friend move. You really just want to focus on yourself. We don't want any spas, pools, saunas, things like that. But you can shower normally. You can still exercise, but nothing that's going to be like Olympic level training or anything. But otherwise, they're, kind of doing things normally, not too many things that are different. We do tell our patients that they should not do any household chores and that their family should assist them with all household chores.